Welcome to the week ahead. My name is Ibrahim Sani. We're doing this live from my home. If you've been keeping an eye on the channel, we've been doing this live from the studio. But we're trying to, of course, continue with the hybrid work culture and allow us to work both from home and from the studio as we can. This is a show that we will explore some of the key things that will happen next week, and we'll try to see how these events can actually impact your lives. Of course, the big news today is this week is the swearing in of Malaysia's ninth Prime Minister. And after he was sworn in earlier on Sunday, earlier today, he gave his inaugural speech. And of course, Prime Minister Datuk Seri Ismail Sabri Yaakob in his inaugural speech said that he touted the concept of Malaysia first, or Malaysia family, Keluarga Malaysia, calling on all people from all different walks of life, including government and opposition MPs, to work together. He says that he would like to appeal to all parliamentarians outside of government to work together to help this nation recover. He says that let us, with open minds and willing hearts, uncover our similarities without digging for differences. We need to find common ground and build consensus. We need to also try to see whether or not we can push the concept of Malaysia family because it is more inclusive. It is like the existence of a family whose members have intermarried with people of various races and religions, and yet the strong family ties that bind them together. He says that to me, the concept of a Malaysian family or Keluarga Malaysia is akin to the strength of a nation bound together by family values. And he also acknowledged that Yang di-Pertuan Agong, Sri Paduka Baginda di-Pertuan Agong, to heed the advice, and as in all the political parties in the country need to set aside their differences. He says that he understands that the political conflicts have besieged the country and have distressed the public, and therefore it is imperative that the political stability is swiftly achieved through togetherness, and this includes cross-party cooperation. And when you talk about cross-party cooperation, after the break we'll talk about what he means by cross-party cooperation. But on the tone of his reconciliatory messaging, of him trying to reach out to the other aisle, this is, of course, a departure from all his previous stances before this. He was seen as a person that is ultra in terms of pushing forward the national identity of Malays through his platform UMNO. And if you look through all his past speeches, he has not been that inclusive in this kind of messaging. So it comes as a shock for folks like me to see him beseeching everyone, not just the Malays, the group that he has been reaching for the longest of time, to work together. So yeah, it is a new way of doing things, I suppose. But then again, we have a new Prime Minister. But of course, we have a statement here coming from him about Keluarga Malaysia. Let's hear him out.
Saya menyeru kepada seluruh ahli Dewan Rakyat, sama ada dalam atau luar kerajaan, supaya menggembeling tenaga untuk memulihkan semula keadaan negara. Marilah kita dengan fikiran terbuka dan dada yang menerima, mencungkil persamaan dengan tidak lagi menggali perbezaan. Kita perlu bersepakat untuk menyelamatkan keluarga kita, iaitu keluarga Malaysia. Saya menggunakan pendekatan keluarga Malaysia kerana frasa ini sifatnya lebih inklusif. Ia merentasi sempadan agama, bangsa dan kaum, di mana kita menyedari kewujudan sesebuah keluarga yang berkahwin dengan pelbagai bangsa dan agama, contohnya di Sabah dan Sarawak. Tetapi nilai kekeluargaan telah mengikat mereka semua. Sebab itu, konsep keluarga Malaysia diambil kerana bagi saya, keutuhan negara terikat dengan nilai-nilai didikan sempurna dalam sesebuah keluarga.
So in the week ahead, we're going to be obviously looking out for the cabinet list. There's a lot of cabinet list PDF that I've been receiving through my WhatsApp. And I'm sure that you have been receiving a bunch of other stuff as well in your WhatsApp. My greatest and strongest and firm argument here is that ignore all this. These are all fake stuff. Don't listen to them. You should listen to the only original statement that is going to come out of the Prime Minister's office whenever it comes out. And when we talk about the cabinet list, we also have to talk about one item, which is the role of the Deputy Prime Ministership. That is not necessarily imbued in the Constitution of Malaysia, but is traditionally accepted as a key role to have. In fact, the Prime Minister, Ismail Sabri, was himself a former Deputy Prime Minister. So now the question is, in the week ahead, will the appointment of the Deputy Prime Minister be made? And of course, who will be the Deputy Prime Minister? Parti Solidarity Tanah Airku President Jeffrey Kittingan said that it would be appropriate to have a Deputy PM from East Malaysia for the first time. The Keningau MP said the Sarawak Kian has a good chance of holding this post because it has contributed to a certain number of votes, resulting in Ismail Sabri taking the PM's office. Let's hear him out.
When asked if there was anyone in particular being considered, Kittingan said it did not matter to him. He said the new cabinet should take into consideration Sabah and Sarawak issues, as well as federal relations and their rights as enshrined in the 1963 Malaysian Agreement. STAR is one of the component parties under Perikatan Nasional.
And to try to understand how we should shape our worldview under the new administration, the AWANI Tonight team over the week has spoken to Dr. Carmelo Ferlito from the Center for Market Education, or CME, a very renowned research house that you should know about. And they highlight about the need for the country to go back to normalcy, and by adopting a fresh new strategy and focusing on the lives and livelihood of people. Let's hear out Dr. Carmelo Ferlito.
That after 18 months of the Perikatan National government, somehow we didn't find the right balance between the management of the pandemic and the management of the other aspects of the life of the people. And I think that also the strategy has been stubbornly focused on lockdowns, waiting for miracles from the vaccination, without understanding and realizing the complexity that was involved, that is involved in the situation we are experiencing. We need desperately someone that understands, realizes how complex is the phenomenon and is able to come out with a new synthesis.
Dr. Carmelo outlines a few strategies in which the government can explore to improve the livelihoods of the people amid the pandemic.
First and foremost, I would put into the agenda the introduction of GST, and in particular a targeted GST to support direct investment in strengthening the healthcare system. So if we are going to live with the virus for still quite some time, we need to invest heavily in making our healthcare system adequate to handle the situation in case the infections would rise again. And I would also advise the government to put together an emergency table for households that are undergoing financial stress, people that have lost the job, and etc., to help individuals and families to find their way back to financial stability with the opportunities that are present in the system.
We'll go for a short break. We'll be back after these messages. Welcome back. This is The Week Ahead. We're broadcasting this live. This is a show where we focus on the items that will happen next week. In the inaugural speech by the Prime Minister, Dato' Sri Ismail Yaakob extended an olive branch to the opposition to join his fight in the COVID-19 pandemic. He is imploring upon some of the opposition members to be part of the COVID task force as well as the National Recovery Plan. Here he is on the issue.
Ke bawah duli tuanku dalam perjumpaan bersama ketua-ketua parti baru-baru ini telah bertitah kepada semua agar melupakan segala perbezaan demi mencapai kesejahteraan dan kebajikan rakyat. Kepada semua pihak sepatutnya sedia bekerja dalam satu pasukan demi mengharmonikan semula suasana. Dalam erti kata lain, kita perlu mendakap erat prinsip kebersamaan. Saya faham kemelut politik yang melanda negara menimbulkan keresahan dalam kalangan rakyat. Oleh itu, kestabilan politik perlu segera dicapai menerusi kebersamaan. Ini termasuklah mewujudkan kerjasama rentas parti. Justru, saya ingin menawarkan ruang kepada kepimpinan pembangkang untuk menganggotai Majlis Pemulihan Negara dan Jawatan Kuasa Khas menangani COVID-19.
And so, as you can see, the offering is out there. The question now is whether or not the opposition is going to take up the offer. Remember, some of the opposition MPs, in particular Tony Phua and Ong Kian Ming from DAP, was arguing that it should be seen as an opportunity for the opposition to embrace. This was when Tan Sri Muhyiddin was the Prime Minister. Now that there's a new change of administration, it seems like the olive branch is still being extended to the opposition members. So in the week ahead, we're going to see if the opposition members are going to take up the offer. So much so that Bangi MP, YB Ong Kian Ming, is also imploring upon the opposition members right now to really think hard about the kind of choices that is in front of them and the kind of options that is made available to them, whether or not these are the good options to take in order for them to combat the COVID pandemic. Here he is on the issue. Let's hear him out.
Saya rasa ini adalah satu permulaan kerana sebelum ni Tan Sri Muhyiddin Yassin pun ada tawar keanggotaan kepada pihak pembangkang untuk menganggotai Majlis Pemulihan Negara, tetapi pada waktu itu hanya satu tempat diberikan kepada Pakatan Harapan. Saya rasa kalau ada keikhlasan yang lebih tinggi, mungkin lebih anggota boleh diberikan kepada Pakatan Harapan. Tetapi pada masa yang sama untuk jawatan kuasa COVID itu dan juga Majlis Pemulihan, kita juga hendak tahu apakah tanggungjawab yang diberikan kepada pembangkang dalam kedua-dua tempat.
Jika pembangkang dibenarkan menganggotai MPN, Majlis Pemulihan Negara dan juga Jawatan Kuasa Khas menangani COVID-19, adakah bermakna segala kejayaan kita atau kegagalan kita menangani COVID-19 moving forward ini juga dipikul bukan sahaja oleh kerajaan tapi juga dipikul oleh pembangkang dan pembangkang juga perlu ambil tanggungjawab?
Ini bergantung kepada tanggungjawab dan juga kuasa yang diberikan kepada pembangkang dalam kedua-dua tempat ini.
Terdahulu dalam ucapan pertamanya sebagai Perdana Menteri, Datuk Seri Ismail Sabri Yaakob berkata kerajaan akan membuka keanggotaan MPN dan Jawatan Kuasa Khas menangani COVID-19 kepada ahli parlimen pembangkang.
So give us your thoughts about what you think, whether or not the opposition should join the current administration in this special committee to combat COVID-19. Use the hashtag AWANI News wherever you get the access to reach out to us on social media. We'll go for one short break. When we come back, we'll discuss a little bit more about COVID itself. Welcome back. This is The Week Ahead, broadcasting live from Astro AWANI. The next few stories will revolve around the healthcare crisis itself. Remember, amongst the first job that the new administration have to do or have to undertake is not only about appointing the cabinet members. Right now, Malaysia is under a caretaker government, despite Datuk Sri Ismail Sabri having sworn in, because there's no ministers, right? So we need to wait for the new ministers to be appointed. But on top of that, the thing that needs to be addressed, like yesterday, in fact, is, of course, the COVID management and, of course, the vaccine management, which over the past close to over a week now, we've had a rudderless kind of management on how COVID is being done. Just today, we saw about 470,000 vaccination doses being administered, which is lower than what was administered on Friday at 480,000. So you can see vaccination rates getting slower, especially during the weekend. Will this be good for the country? The answer is no. So how do we keep it up? How do we ensure that the vaccination rate keeps up above the 500,000 daily rate? Having said that, it's important for us to also note that the data has shown that over 30 million doses have been administered, resulting in over 15 million Malaysians or people living in Malaysia have at least received the first dose. And we also want to talk about in this light what the Prime Minister has said earlier on in his address, inaugural Prime Ministerial address late on Sunday. He says that a further purchase of 6 million doses of vaccines is to be made to ensure herd immunity is to be achieved as soon as possible. He cited that the Labuan example is a good case study to look at because, according to him, Labuan has achieved herd immunity and cases have dropped tremendously there. Let's hear him out.
Gambaran ini bukanlah satu angan-angan kosong kerana negara kita pernah berjaya menurunkan statistik pesakit COVID-19. Fakta terkini pada Jumaat 20 Ogos 2021 membuktikan keberkesanan strategi lalu. Statistik kes harian wilayah Persekutuan Labuan yang sudah mencapai 90% imuniti kelompok dewasa telah menurun secara konsisten kepada 1 digit selama 7 hari berturut-turut. Sehubungan dengan itu, demi memangkin pencapaian seperti di Labuan, suka saya umumkan pembelian tambahan sejumlah 6 juta dos vaksin lagi yang akan diterima menjelang awal September 2021 sebagai satu berita baik kepada semua bersempena bulan kemerdekaan ini.
So as you know, we have mostly the double dose kind of variant or ability for us to give the vaccines, either AZ or Pfizer. But a single dose vaccine called CanSino has just arrived in Malaysia on Friday. We're looking at over 20,000 CanSino doses arriving. And this is good because it can be delivered to rural areas in Malaysia. And we also made a short story on this, particularly on how CanSino is going to be rolled out next week in and across Malaysia.
A total of 200,000 doses of CanSino vaccines developed by CanSino Biologics Incorporated from China arrived at Kuala Lumpur International Airport this morning. The COVID-19 Immunization Task Force in a statement said the finished product doses are part of the 3.5 million ordered from CanSino for delivery in stages. The CanSino jab was granted conditional approval for emergency use in Malaysia by the Drug Control Authority on June 15th.
Internationally, the United States will begin offering COVID-19 vaccine booster shots from September 20th onwards there. Healthcare workers, nursing home residents, and the elderly will be prioritized as they were amongst the first group to be vaccinated late last year.
U.S. officials said they will offer a third shot to Americans who received their initial vaccines made by Moderna and Pfizer-BioNTech at least 8 months earlier. The decision, they said, was based on data showing diminishing protection 6 months after inoculation, especially in older people with underlying health conditions. President Joe Biden said the government expects to give out 100 million booster shots for free at around 80,000 locations nationwide. The announcements made by the U.S. defies guidance from the WHO, whose chief scientist said current data does not indicate the need for booster shots.
So our final item that we want to explore next week is that what would be some of the biological differences that may be coming about when it comes to the Delta variant of COVID-19. According to the medical lecturer from UPM, Associate Professor Dr. Malina Osman, she says that we might not have much option when it comes to complying with the SOP because Delta variant can spread particularly through the nose. Let's hear her out.
Dalam konteks tu, kalau kita tengok, macam vaksin yang sedia ada ni memang taklah seperti mana yang kita harapkan sebelum ni. Ya. Maksudnya kalau sekata dah vaksin tu, virus tu sepatutnya dia tak mampu untuk colonize. Ya. Maksudnya tak mampu untuk membiak lah. Tapi disebabkan oleh mungkin perubahan ciri-ciri biologi menyebabkan dia boleh nak berbuat macam tu. Dia memberikan kita satu situasi lah yang mana memang semua orang perlu berjaga-jaga lah. Tindakan SOP tu macam yang berbahagia diri bagi tahu memang kita tak boleh lalai lah. Even dekat Amerika Syarikat pun, walaupun sebelum ni mereka dah membuat garis panduan ya, tak perlu pakai pelitup muka, tapi bila dia orang dapati dah ada Delta varian ni, memang arahan untuk memakai semula mask seperti sebelum tu telah dikuatkuasakan semula.
Right. So before we end this show, we want to talk about long COVID. A lot of you already know, but we want to learn more. The majority of people infected with COVID-19 generally recover within 2 to 3 weeks, depending on the severity of the illness. But sometimes they might continue to experience post-COVID symptoms called long COVID, in which symptoms persist running into the months. To understand what better causes this long COVID situation, the AWANI Tonight team spoke to Dr. Erickson Chia Kwan Min from the Sunway Medical Center.
As we learn more and more about the COVID virus, it seems to us that it not only causes long-term complications to the respiratory system in the body, but it also affects the other organ systems in the body in the long run as well. Some studies have also shown that there have been psychological complications being reported. And with the large number of cases that we have in Malaysia and also worldwide, some of the public health experts have actually warned that long COVID could very well be the next public health disaster in the making.
Dr. Erickson outlines some of the common symptoms of long COVID that patients may experience.
In Malaysia itself, we do have some data that up to 60% of the patients do experience long COVID symptoms after 12 weeks from the initial diagnosis of COVID-19. So this is about 6 out of 10 patients who have had COVID who may present with long COVID complications. Some of the common symptoms that they do have fatigue, breathlessness on exertion, difficulty sleeping, cough, and also some chronic pain. These symptoms will definitely affect the patient's quality of life and their day-to-day activity. Imagine just becoming breathless, just going up a flight of stairs, being unable to think clearly due to brain fog, having persistent pain. These things can also lead to depression as well.
Sunway Medical Center will be among the first COVID recovery clinic established in the country, hoping to treat patients who suffer from prolonged COVID symptoms.
So Sunway Medical Center will be the first private facility to offer this, we call it the COVID Recovery Clinic, in which we have a structured, multidisciplinary and a holistic approach towards managing patients who do present with long COVID symptoms. With the establishment of a proper COVID Recovery Clinic, this would also help patients who not only are from Sunway Medical Center, but from probably have been discharged from other hospitals who do have long COVID symptoms and are seeking a way to assist them to elevate their symptoms.
So, yeah, if you have long COVID symptoms, reach out to the medical practitioners out there if you require further help. But for now, that's all there is for this episode of The Week Ahead. It's going to be a very busy week ahead for many of us. So my suggestion is to continue to remember to comply to the SOP. Of course, if you're a Chelsea and Arsenal fan, the kickoff is going to happen in 30 minutes. Romelu Lukaku starts for Chelsea. I can't wait for that. So I'm going to be having a good week ahead if Chelsea win against Arsenal. That's it for me for this particular episode. Thanks very much for watching. Catch you in the next one.